Hello there, and welcome. My name is Calliope, and I'm going to be performing your examination. Would you mind if I just confirm a few details from you? Wonderful. If I could just have your name and date of birth. Good. And is that your preferred name? How do you like to be addressed? Okay. Wonderful. Now, is there any particular reason why you wanted to have this examination today? Anything in particular we're looking for? Okay, just a general examination. That is just fine. Now, generally, we like to do sort of a top-down approach in which we work from the head down, or we might take a look at the symptoms first. But with you, I'd like to go more of a bottom-up sort of approach, or more specifically, I'd like to do the examination backwards, almost. Is that okay with you? Wonderful. We'll still hit all of our beats, it's just going to be in a different order. Now for this examination, I am going to need to touch you. Is that okay with you? I have your consent to do that. Excellent. Thank you. Now to start, we often end with a reflex exam, but I'd like to start with our reflexes. So I am going to begin with the Achilles tendon reflex, also known as an ankle choke. So I am just going to need your foot, and I'm going to put a little bit of tension on the foot by pulling it up just a bit so that we can isolate that area a bit better. And we'll just do a few taps, just like that. And the other foot, if you'll just let it go slack as best as you can. Good. And then we'll move to the patellar or the knee jerk reflex. Now the funny thing about the hammer we're using good. Let the leg go slack. This type of hammer is called a tailor or a tomahawk hammer. Good. Now I'd like to do biceps, triceps, and brachioradialis. So I'm just going to hold your arm here. I'm going to put my thumb right in the crook of your elbow. This is called the cubital fossa. And my other fingers are going to wrap around the elbow. And I'm going to be tapping on my thumb to elicit that reflex. Good. So the Taylor hammer was the first reflex hammer to be developed. And it was developed by a neurologist called John Madison Taylor. I'm just going to be getting the triceps reflex back here. So if I could just hold your arm and let it relax. Good. Now we may think of reflex tests as pretty commonplace. Good. But the concept has not actually been around that long. And then brachioradialis. It's going to be this big muscle right on the radial side. It's part of the name. If I could just have you relax the arm. Good. And actually, I think it was a paper published in perhaps maybe 1885 that had detailed reflexes that a couple of doctors had found. Good. Just put that away. And it was knowledge to some medical professionals that there were reflexes, but it wasn't standard knowledge. So up until the late 1800s, it wasn't something that many people knew about. It's kind of funny how far we've come with medicine and all these different tests. And it's funny how simple sometimes it can be. I'm just going to write some notes on this. The reason that we do a reflex test is it's part of a neurological examination. And if there is something wrong with the reflexes, that may indicate that there's something wrong with certain nerves in the body, in the spine. We might have some sort of lesion, for example. So it's very important. Now, I'd like to move up to the heart and lungs. I'd like to start with some palpation around your chest. So what I'm doing here is I'm feeling for palpable heart murmurs. And we're looking for two kinds specifically. And these are called heaves and thrills. Now, to isolate the possibility of these, I use either the heel of my hand or the flats of my fingers to feel for these. Just have to change the direction of my hand here and feel around. Good. Okay, so we're going to start with the heart and then I'll move to the lungs. So let me do some auscultation with the heart. Now I'd like to just start with the aortic area of the heart, where the aorta is. Now, when your blood is circulating through the heart, it comes in through your right side, and it is funneled to the lungs from the right atrium, then the right ventricle. Then it comes back to the left side of the heart to be sent to the rest of the body. Good. Now we're going to listen to the pulmonary area. This is where we have the pulmonary valve. Good. Good. And then the tricuspid valve here. A lot of what I'm listening for here is actually the sound of the valves closing, opening and closing. They're quite loud if you think about it. And then we have the mitral valve, the mitral area of the heart. Good. Okay, so I am going to locate and then take a listen to the apex beat. So this is going to be the mid-clavicular line, and it's going to be the 5th intercostal space down. The intercostals are those little muscles between the ribs. So we can come from the sternum and just count 1, 2. And then meet my fingers right at that spot. So we'll just make sure it's there. It's supposed to be about in this spot. If it's not, we might have a bit of an issue, but that is very clearly in the right spot. And then I'd like to have a listen here. Just keep breathing normally. Good. Good. Okay, so apex beat sounds good. Now I'm going to be doing a quick test with the lungs before we do a little more auscultation. So I am going to be using some indirect percussion to take a little listen to the insides of your lungs. So what I'm going to be doing is I am going to be tapping one of my fingers on the fingers of my other hand while it's on your chest wall. And depending on the sound that comes back, whether it's hyperresonant, whether we have a dull sound to it, maybe we have a stony dullness, can tell me about potential issues with the lungs. So I'm going to place my hand right on the chest here, and we're just going to do a couple of taps here. Good. And compare it to the other side. And down. Good. Good. Very good. So that sounded good. Now, to listen to the lungs, I am going to prompt you when to breathe. So if I could just have you take a deep breath in for me. And out. And switch to the other side. Deep breath in. And out. Good. Move down. Deep breath in. And out. Deep breath in. And out. Deep breath in and out. Deep breath in and out. Deep breath in and out. Last one. Deep breath in and out. Good. Now we're going to do a test that's a little redundant because we did our percussion, but I am going to perform a vocal resonance test with you. So what I'm going to have you do is when I put the stethoscope on your chest, I'd like you to say the word 99. And I'm going to listen to how the word sounds in your lungs as you're saying it. Again, we're looking for resonance, whether it's hyper resonant or it has a specific kind of dullness to it. So if I could just have you say the word 99, 99, 99, 99, 99, 99, 99, 99. Wonderful. Take this out for a little bit. Now we're going to be moving up, so I'd like to take a look at the neck first. So I'm going to just look at the muscles. We're going to be feeling around the thyroid. Good. And I'm just going to place my fingers along the neck here, the front of the neck. If you could just take a dry swallow for me. Just like that. Just going to feel around the thyroid. Very good. Okay. So I'm going to bring out the stethoscope for one last little test. We're going to listen to the carotid arteries. Now what I'm listening for is what's known as a bruit, B-R-U-I-T. This is an audible heart murmur. So I'm going to put the stethoscope on one side of the neck. If I could just have you take a deep breath in and hold. Good. And let it go. Good. Other side. Deep breath in. And hold. Good. And let it go. And then we can put this down. Now, since I have listened and have found that there aren't any bruits, I'm going to do some palpation around the carotid artery. So I'm going to do this one at a time because the neck is quite a vulnerable place, especially the carotid area, and it can be pretty uncomfortable to have someone pressing in, so I'll be quite brisk about it, and I'll just do it one at a time. That way it's quick and easy. Good. Good. Now I'm going to be feeling the lymph nodes now. You have many, many lymph nodes in the body. What I'm going to be feeling for is some of our major areas. We have the occipital nodes right near the occiput. So this is going to be about the area of the hairline or around where the head meets the neck. Then I'm going to bring it forward and we're going to feel behind the ears. These are the post-auricular nodes. And then we're going to feel in front of the ears, and these are pre-auricular nodes. So the post are behind, pre are in front. And then we have submental and submandibular underneath the jaw here. And then we come to the neck. We have superficial cervical, deep cervical chain, posterior cervical. So I'm going to start at the back of the head here. And we're just going to feel those occipital nodes. And we're looking for any swelling in this area. Any sign that your body is fighting off something. Okay. And then we're going to come right behind the ears. Good. Okay. And then in front of the ears. And under the jaw. These get a little bit of a rolling motion. It's quite an interesting feeling to have one of the lymph nodes under the jaw be distended. You can get a bit of a rolling to it, and you can feel this sort of movable lump underneath the skin. It's quite odd. Wouldn't recommend it. Okay, and then we come to the neck. We have our cervical nodes here. Cervical being the Latin word for neck. Good, and I did leave one spot out. So after the neck, we have supraclavicular. This is above the clavicle. Just feel supraclavicular here. It's one of our big hot spots. I want to make sure that there's nothing here. Good. So lymph nodes feel real nice, so I don't have any worries about those. Now I'd like to move on to your sinuses. So your sinus cavities are going to be the frontal, at the frontal bone, your forehead here. We have the ethmoid with the nose around the ethmoid bone. And we have maxillary, which are around the maxilla, or that upper jawbone. So I'm going to be doing two different kinds of techniques with this. Firstly, I'm going to do a palpation in which we're going to be pressing in on these areas. And I'm also going to be doing a direct percussion. If you recall, with the lungs, we did an indirect percussion, which means that there was a barrier between me doing the percussion and your body. With direct percussion, we are directly percussing the area. So first, I'm going to press in. Let me know if any of this is painful at all. It's going to be quite firm. I want to see if there's any issues with the sinuses. Do we have some congestion? Maybe a sinus infection. It's pretty common this time of year. Good. And what about in the nose here? How is that? Okay. And what about in the maxillary area? Anything there? No? Okay. So now I'm going to do our direct percussion. Let me know if it's painful or tender at all. So we're going to get the frontal sinuses here. The ethmoid sinuses here. Good. And the maxillary. Good. And that was all of that. And that was fine as well. Wonderful. A few sections to write some notes down. And then we can work more with our head and face exam. I'd like to have a little look over the face. As we've been speaking, I haven't noticed any hoarseness of voice. I've noticed you've been breathing just fine, and you are alert and oriented. Your facial features are proportional, and there's no asymmetry at all. So far we're looking good. But I just want to get an up-close look. So, just going to look around and make sure I'm specifically looking in different areas here. Good. Your skin's not reacting to my touch, which is good. Some people, when you start touching their face, they get all red. You feel kind of bad because now they're all red, and I am one of those people as well. As soon as I start washing my face or scratching something, it's all red. Yeah, I'm just going to take a look at the eyebrows here. Good. And the eyes, just taking a look at those. Good. Okay. And the tissue around the mouth here, got good coloring. At this point in time, most people's lips are chapped or kind of bitten. Okay, good. So skin looks good. Not noticing anything out of the ordinary. And I'd like to do a bit of muscle testing. So I am going to be palpating the temporalis muscle, the masseter muscle. I'm also going to be testing the TMJ area, your temporomandibular joint. So I'm just going to feel around the temporalis muscle. Your temporalis, your masseter, and some deep muscles are used in what's called mastication. I have to make that very enunciated, mastication. And that is chewing. So that's why the masseter is called as such. And if I could just have you clench the jaw here and unclench, clench, unclench. Wonderful. We'll get into the masseter. Very powerful muscle here. Good. And if I could have you just clench, unclench, clench, and unclench. Good. Now for our temporomandibular joint, I'm just going to be palpating that hinge there, and I would like you to open and close your jaw a few times. If I could have you open the jaw, close, open, close, open, close. Good. Okay. So, motor function looks good. And was there any sort of pain or restriction in the jaw? No, it's all good. Okay. Let's take a little look at the eyes now. I'm going to be pulling the eyelids up, like you to look down. And I'm going to look at the tissues of the eyelids here, all around. This is the conjunctiva. Good. Just keep looking down. Okay. And I'm going to pull the eyelids down, like you to look up. That helps exaggerate the area so that I can take a good look. Keep looking up. Okay. Very good. All right. So I'm just going to have a peek. The sclera is bright and clear. It's a bright white color. Our tear ducts are pink and moist. I know that many people don't like that word, but it comes up a lot in medicine. We want our tissues to be pink and moist. Good. Okay, that looks good. Now I'm going to look at the eyes with a spot of light. This is going to be a little bright, okay? So if I could just have you look at my nose here. And I'm going to bring the light in. And what I'm looking for is that the eyes are equal, round, and reactive to the light. Eyes as in the pupils. I'm looking at the pupillary response. Very good. Do you wear glasses or contacts? Okay, good to know. Okay, one more time. Here we go. Now I am going to have you just look at my flowers back here. Okay, just focus on the flowers. And then focus on my finger. Good. Focus on the flowers. Focus on my finger. Back to the flowers. And then my finger. If you could just follow this finger as it comes in and out. In, out, in, and out. Good. Now, if you could look at the wall behind us here. Okay, and then look at my finger. Good, and look at the wall. And look at my finger. The wall. Look at my finger. And we're going to bring it in, out, pleased with that. Now I would like to take a peek in your ears real quick. So I've noticed that you haven't asked me to repeat myself. You have seemed to hear everything just fine. Is that accurate? Okay, and do you notice if you have any issues with hearing at all? Okay, let me grab a new speculum. Do you happen to have any issues with pain or a feeling of fullness in the ears and itching, anything like that? Okay, very good. So I'm going to have a little peek in the ears. It's not going to be anything special. I just like to make sure that the ear canal is clear and that the tympanic membrane is in good health. Looking for signs of infection, impaction, that sort of thing. Good. Nothing too fancy. So our tympanic membrane, or our eardrum, this should be a slightly translucent pearly gray color. I should be able to see the tip of the malleus behind it. There should be no bulging, no perforation. Okay. And that all looks clear. I'm going to take off the speculum and we're going to move to the nose now. If I could have you tip your head back a bit. We're just going to take a quick little peek and look at the septum in the middle of the nose. Look at the health of the nasal passages, and I can see a little bit of the turbinates in the nose there. Okay. And you can put your head back. How is your sense of smell? Have you noticed any sort of weakness in that area? Or perhaps an oversensitivity? It's less common, but can happen as well. Okay, very good. Let's take a little look inside the mouth. I am going to have you just open the mouth here. Gotten a good look at the lips. Okay. Can you lift your tongue to the roof of your mouth for me? Good. You can put it down. I'm going to grab a tongue depressor here, and I'm just going to take a peek inside the buccal mucosa pockets here. Good. See a little bit of the salivary glands. Right, and then I'm just going to have you stick out your tongue and say ah. That way we can get the tongue out of the way. There we go. And would you mind saying ah for me again? Good. Uvula looks good. Midline. Okay, we'll just take a look at the throat here. It's the time of year we see a lot of sore throats. Sometimes it's just from dry air. Sometimes it's from really any number of things. Sickness mostly. and close your mouth. So now I'd like to do a scalp and hair inspection. So I'm going to be palpating the scalp as well as looking at the hair, making sure that the quality is correct for your type of hair. Start by just feeling the contours and ridges of the head. And making sure what lumps and bumps should be there, are there, and what ones should not be there, are not. Okay, from the frontal bone all the way to the occiput. Good. Shape of the head's good. We have our symmetry. Okay, just checking the hairline here. And just following that all the way around. Just following. To the back. Okay, and you haven't been experiencing any itching or dryness, flakiness, oiliness with the scalp? No. And I assume since I'm not finding any lumps or bumps, we haven't had any recent head injury? No. Okay. Good. Let's look at the hair. So I just want to make sure that the quality of the hair, its texture is correct for your hair type. And we're also looking for signs of alopecia. So running my hands through the hair, seeing how many hairs I catch from that. Okay, and I'm just going to tug on one of the hairs and check its strength. Okay, and on another side. Okay, so hair looks pretty strong and scalp looks good. So, are there any particular areas that you feel I may have missed? You are absolutely correct. Thank you for reminding me. We're going to bring out the stethoscope for Auscultation Part 2, Electric Boogaloo. And we'll take a listen to the abdomen. So we'll do our auscultation first. And don't have to do any sort of special breathing pattern. Just breathe normally. If I were to go in straight with our palpation, then that might alter the sounds that the organs would be making. And now I am going to do some percussion. So we're going to do our indirect percussion where I tap on my fingers here. This can be used for listening, the contours where fluid's supposed to be, making sure there's no fluid where there's not supposed to be. Good, and then we can go in with our palpation. There's going to be two types of palpation. We have a firm and a deep. So the firm I can do with one hand. The deep I'll be doing with two. So our firm palpation has more of a medium pressure to it. Let me know if any of this is painful or tender. Abdomen is also one of our more vulnerable places, just like the neck. And then with our deep pressure, this can be quite uncomfortable. So when I do this, the examination itself is not very long. It does help to just focus on breathing through it. Can be a little more difficult since I'm pressing down on the area that often fills with air. And that's it. So that's all done. Okay. Are there any other particular areas you feel that I've missed or you'd like me to go back over? Okay, that about does it. Very good. I appreciate you keeping me on my toes. Very good. Any questions for me at all before I sign off? And that will conclude our examination. I'd like to thank you so much for coming in today and getting this general examination. You were an absolutely wonderful patient. I hope you have a whale of a day and a good rest of your night. Thank you.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays, but I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon, or I also have a Ko-Fi link for a one-time donation or a throne wish list for props and equipment. Thank you again, and I hope you have a whale of a